Okay, we are now live. We'll give it, hi everyone watching us. We'll give it 2 minutes. If I, by mistake, kick anyone out, please come back with the same link, or if you disappear for whatever reason. Okay, so I'm now just moving you from the stream. That's all. You're still with us. We're starting shortly. All right, I think we're ready to start. All right, I think we're ready to start. I have my voice somewhere, I can't find it. Good afternoon. My name is Ahlam Muhtasab. I'm a professor of communication studies at California State University, San Bernardino. I'm also the director of the Center for the Study of Muslim and Arab Worlds. Welcome all. We are on our third day of the blessed month of Ramadan. So I would like to start by saying Ramadan Mubarak to all of our panelists and viewers who observe Ramadan. I'm personally observing Ramadan, so I'm fasting now because it's in California. It's actually early afternoon. So if there are any glitches, I could blame them on that, on my fasting. Welcome to our panel discussion, COVID-19 in the Muslim world. Today we have 5 distinguished speakers representing 5 Muslim countries. But first, let me begin by acknowledging that CSUSP sits on the ancestral and unceded territory of the Serrano Yucatecan people, also of the Tongva people throughout the Los Angeles region to the edge of San Bernardino. We request permission and forgiveness from the indigenous ancestors of those colonized lands. On behalf of the CSUSP Center for the Study of Muslim and Arab Worlds and CSUSP Intellectual Life, I welcome you all to our COVID-19 in the Muslim World panel, which I will be moderating. In the StreamYard broadcast studio, I also have my dear colleague, Dr. H.A. Alkan, who will be helping me. The COVID-19 pandemic uncovered many underlining issues in different societies, including, of course, the United States, but around the world. Issues of health, preparedness, disparities, inequities, and racism, to name a few, became prevalent in many societies. However, the pandemic also showed that we all share one global village in which our destinies are interconnected. This panel will include 5 speakers from 5 different countries in the Muslim world: Bangladesh, Turkey, Palestine, Lebanon, and Yemen. So far, we don't have all the speakers, but we hope that they will be joining us soon. I will introduce our esteemed guest speakers shortly, but first, few words about our center. CSUSP Center for the Study of Muslim and Arab Worlds is a multidisciplinary center housed in the College of Social and Behavioral Sciences, and its core mission is dedicated to broadening and decolonizing knowledge about the Muslim and Arab worlds through teaching, research, and community outreach. The center is dedicated also to be inclusive of the study of all ethnic, religious, and cultural populations in what is historically have been known as the Muslim or Islamicate and Arab worlds. Our executive board includes scholars from most colleges of CSUSP. We are also proud to house Arab Studies Quarterly, the journal which was established in 1979 by the late professors Edward Said and Ibrahim Ablughad as the first journal dedicated to Arab studies in the US. In the spring of 2018, our center jointly hosted the first Arab Studies Quarterly Conference at our CSUSP campus with the theme of US hegemony and the Arab world. Our second conference was postponed due to COVID-19. That's why it's important to talk about it. To March of 2022. You can find more information on about our upcoming conference at our website, which I will put in a minute actually on the screen, but it is csusp.edu/CSMAW. We are proud to have hosted over the years many educational programs like film screenings, book discussions, lectures, and panels on many topics related to our historical and geographical regions. Today is no exception, and we are very proud to have such an amazing lineup of speakers who will each speak for 10 to 15 minutes about the COVID situation in their motherlands according to alphabetical order, followed by Q&A with the audience who are joining us on both YouTube and Facebook. Please feel free to type your questions, and we will try to answer as many as we can after the presentations are done. So now it is my utmost pleasure to introduce our first speaker, Dr. Ali Riaz. So give me 1 second. Good afternoon, Dr. Ali Riaz.
Thank you, Professor Mustasheb. It's a pleasure to be here.
I'll introduce you if you don't mind. I'm going to read a short blurb about you.
Sure.
Dr. Ali Riaz is a distinguished professor of political science at Illinois State University, a non-resident Syrian fellow of the Atlantic Council, and the president of the American Institute of Bangladesh Studies, AIBS. He held various positions at ISU, including the chair of the Department of Politics and Governments from 2007 to 2017, and the Thomas Emmerman Professorship 2018 to 2020. Dr. Riaz previously taught at universities in Bangladesh, England, South Carolina, worked as a broadcast journalist at the British Broadcasting Service BBC in London, and served as a public diplomacy scholar at the Woodrow Wilson International Center for Scholars at Washington, D.C. Dr. Riaz's recent publications include Religion and Politics in South Asia, which is coming this year, right? It's being out, I think. Oh, okay. And Election in a Hybrid Regime, explaining the 2018 Bangladeshi elections, which was published in 2019. Thank you so much for joining us. Dr. Riaz, it's all yours now.
Thank you. It's a pleasure, and thank you for your generous introduction. And I'm really pleased to be, and an honor to be part of this esteemed colleague whom I look forward to listening to. Today, of course, the panel is going to look into the reactions and responses of the Muslim majority countries. As you have done, picked up a few of the countries, that is quite important in understanding the responses and reactions. It is needless to say that the COVID has not spared any one of us in our private life, not to mention the social and economic lives of many, many, many people. And unfortunately, we have seen the mismanagement of it, death, including in the United States. And the reactions that we have seen and responses that we have seen in the Muslim majority countries, like any other places as well, it has been diverse, it has been disparate in many ways. I think in understanding any response or what we're seeing, the implications of the COVID-19, I would say there are 4 dimensions that we need to look into. These 4 dimensions are the public health dimensions, the economic fallout dimension. The third one is currently the vaccination situation, and of course, fourth, how the religious community have responded to it. And I will focus on Bangladesh, the country that I am from, on these four dimensions. The public health dimension, currently as we speak, Bangladesh is experiencing the second wave of it. The first case was identified in last year, March. It has been almost more than a year. And after a while, it went into the peak in the summer of 2020, and then it subsided to a certain extent, and then it has picked up. So since the late March, we have seen this picking up, and now currently, as we speak, it has already been infection rate has gone few fold. Possibly it is about sevenfold that if we consider compared to about a month or a half ago. The death has tripled. It has almost reached 100. 10,000 deaths have been reported so far. At least the official count is about 10,000 people have died of it. And a lockdown, this is the second effort, so to speak, in Bangladesh that the complete lockdown has been imposed, or at least government has declared it. But it is poorly enforced, largely because it has been quite badly managed. You know, most importantly, last summer when it started, the mismanagement has reached to that point that the public health crisis became so devastating that many people couldn't actually find hospitals to go to. It was expected that the experience of the last year, particularly the last year, given that there was no previous experience of it, some of the mismanagement, though unacceptable, was accepted to the extent that, okay, there has been no experience of it. It has happened in the United States, it has happened in Europe, and elsewhere in many countries that we have seen. However, the experience of last year seems to be have gone missing. There has been any lesson learned. For example, the public health system seems to be almost crumbling, as it happened last year, particularly in summer. The there's hospital beds have become scarce, even for the common healthcare. Uh, ICU is seems to be full, and there were promises that the new hospitals will be built, and there has been an attempt, or at least apparently there have been some attempts of having new hospitals, particularly focusing on the public health issue and particularly on COVID. That seems to have not worked. So it is a deja vu kind of situation in Bangladesh with respect to the public health. Uh, the second element is the economic fallout situation. Last year, when Bangladesh experienced the first wave, Bangladesh government stepped up, or at least they made some effort. There are 19 stimulus packages that have been announced since they started in April. That is April 2020 to January 2021. Over this period of 9 months, in various bunches that we have seen, the stimulus packages have been declared. And altogether, it is not a small amount of money. I would say 4.4% of the GDP have been allocated in these stimulus packages. Uh, and these stimulus packages, when we saw the first time, it started with the ready-made garment sector. Reason being, the ready-made garment sector is one of the major pillar of Bangladesh economy in terms of its revenue earning, and particularly given that it is export oriented. Bangladesh revenue has largely dependent on two sources. One among them is the RMG, another being the remittance sent by the short-term migrant. So the first effort and the first approach was to address this because there have been major disruption in the supply chain, and particularly given that the Western countries had started quite unfortunately unannounced, unanticipated manner that they have started cancelling those orders. So government stepped up, and but that didn't actually work out in the sense that in many cases that benefit didn't trickle down to the workers who are the pillars of this. The health issue was not addressed, and similarly, now not only in terms of the RMG sector, what we saw in the 19 packages, there has been a focus towards the large business and corporations. Medium and small sectors, the medium and small enterprises, and the micro enterprises, and the informal sector, these are the backbone of Bangladesh economy. If we look at the, in terms of the employment, in terms of the involvement of the number of people, small and medium sector remains the backbone of Bangladesh economy. Yet, what we have seen that the disbursement of these stimulus packages, the financial incentives, have been largely towards the large corporations. It is very unfortunate at a time when we know for sure that the poverty has gone up to the extent that one of the research organizations has suggested, drawing on their data, that Bangladesh has seen in the past 1 year, the extreme poverty has gone up. The poor people, the share has been, the poverty has doubled from 21 to 42%. Even all these things, and particularly looking at the agricultural sector, these have not actually worked out for those who are on the margin. This is unfortunate reality that we have experienced. And in terms of the adherence to these lockdown situations that we saw last time, lockdown was so unplanned that it didn't actually take into account those who are in the informal sector, and largely in the urban areas, particularly in the capital Dhaka, that they have not been attended to. The government's initiative for cash transfer was marred by largely corruption by the ruling party activists and ruling party leaders. That was very devastating. Government stepped up, tried, but it seems that the corruption is so endemic, and the partisan nature of the current government is so much inimical, detrimental to serving this largely marginalized community, seems to be a problem. And there is a lack of trust between the government and the people. Uh, that lack of trust has contributed to the questioning of the total number of deaths with respect to the availability of this help, with respect to the public health. Why there is a trust deficit in this case? Because of the over the last years, we have seen the democratic erosion in Bangladesh, and by being sliding towards an authoritarian system, it seems that the government is increasingly losing the confidence and the trust of the people. So, is this country right now ready to have the second waves follow? Uh, it is unlikely, despite the fact that it has received enormous support, and government is taking credit for the economic uh, turnaround. At least that is what the government insisted on and claimed to. Yes, there has been some economic turnaround, but unfortunately, it remains within a very small sector and is not helping a large segment of people. The third point is the vaccination. And the vaccination conversation, with respect to not only the Muslim majority, not only in terms of Bangladesh, we need to preface it with one thing: the global picture. It is a stunning disparity that we are experiencing. We are speaking from the United States. Here, by summer, there would be 300 million doses that would actually be extra. Yet there has been countries which has not received a single dose so far. Most of them are poor. Most of them are either middle income country, lower middle income country. And if we look at the global effort, COVAX, the global effort have bought only 13% of the total. They have distributed 38 million doses only to 98 countries. We can understand what is the situation. 14% of the global population has now their countries, the countries which has 14% of population, has secured 53% of vaccine. This is the disparity situation that we are witnessing. This is unacceptable. This is the context that we have seen, whether it's Canada, whether the United States, whether it is the United Kingdom. They have been hoarding, where millions of people are living and left out in this. So in case of Bangladesh, the situation is a little bit better, I would say, a little bit better compared to others. How? The Bangladesh is, from COVAX facilities, Bangladesh is supposed to get 11 million of doses. 11 million vaccine should be allocated in the first round. When that is going to go down, we don't know. Hopefully, by April in the coming days, if not early May. But in the meantime, what Bangladesh has done is, given its relationship with India, they have bought 30 million from what is called the Indian lab. The Indian lab, the Serum, has actually been the largest producer of vaccine. So being the largest producer of vaccine, and given that Bangladesh actually have a private contract, uh, a private company in Bangladesh contracted out on behalf of the government to get 30 million. However, so far, Bangladesh has received 7 million out of that 30 million. And 3 million vaccines have been given by India as gift. So altogether, it is about 10 million people. So what happened is, so far, 5.65 million people have been vaccinated, which is the first dose, one dose. That is 3.5% of the Bangladeshi population. If we are considering those who have taken the two doses, who have received it, that would be very small, 0.3%. Fortunately, the extent of infection that we have seen in case of other countries, Bangladesh has been better off. Yet, if the vaccines are not coming on time, how that is going to be affected, we will have to see, but that it doesn't look good. Particularly, Bangladesh relies on a single source. Bangladesh was offered by China, but it didn't. Uh, uh, Bangladesh was offered by China. It seems to be the geopolitical consideration of Bangladesh pushed, given the Bangladesh government's close relationship with India, and possibly to a certain extent, in a prudent manner, Bangladesh moved to secure this 30 million. So far, as I have said, Serum, particularly in India, has not been lived up to the contract. Hopefully, that would be adhered to. If so, the question is, having 523,000 people having both shots, which is 0.03%, 3.5% having one shot, what does that mean? That means that there's a large challenge that Bangladesh is going to face in terms of the vaccination. Given the disparity that we have seen in case of the global context, Bangladesh's challenges are far more greater. And in a government, when there is a challenge of trust deficit, that actually compounds the situation. Let me finally quickly talk about the reactions from the religious leaders, because in many cases, we have seen in some of the Muslim majority countries, there have been some reactions, somewhat a resistance from the religious leaders community with regard to the validity of the COVID-19 and also the vaccination. Bangladesh Islamic religious leaders have not dismissed COVID. There have been, initially, there had been a fringe discussion that it is not, it is going to be only affecting those who doesn't believe in, who is not faithful. Those kind of arguments were largely fringe. The stigma that we saw is not because of the religious one. Stigma that we saw in case of Bangladesh is largely a matter of, societal structure, understanding. That happens with many other things, which is unacceptable, very unfortunate, but that has been the case. Initially, last year during the Ramadan, we saw there have been insistence from the religious community, religious leaders, to not close down or impose lockdown on the mosque. In some cases, the government instructions have not been adhered to, but in large measure, we would see that the faith has not actually determined how they have reacted. Recently, as we speak, as all the schools and colleges, the education institutions are closed, the ulama, those who are in the religious sector, they have insisted on keeping the religious seminaries, which are called madrasa. In case of Bangladesh, these madrasas need to remain open. Most of these madrasas that we are talking about are residential and with children. Fortunately, children have not been infected, at least globally, that is the pattern. That might have protected them. But given the circumstances, their insistence, which government might have to, unfortunately or fortunately, government might have to, in some cases, succumb to their pressure. However, the as we enter into the second Ramadan of this COVID, with regard to the prayer and everything, the question is whether this would be adhered to when it comes down to whether faith would be a determining factor. I do not anticipate that one. Generally speaking, that non-adherence towards the government's lockdown, non-adherence towards the government instructions, uh, and also the government's lack of a coordinated policy to address those who are on the margin, how that would be addressed, how they would be faced with this complete shutdown means complete lack of economic activity, those who are in the informal sector, how they are going to face that. Vaccination question remains at the forefront of everything until and unless Bangladesh starts looking for other sources, perhaps because altogether there are 12 vaccines that are available. One, the Johnson & Johnson has raised some fund, AstraZeneca is there, so despite all these things, there are available ways to maneuver. Whether the geopolitics, the relationship with India might influence government's decision to rely singularly, exclusively on India, that would be very much detrimental. I understand, and I hope the government has taken that into account and explored other resources. So, with that, these four elements that I think should be taken into account and discussed, I would stop it here. And thank you to CSU and particularly the center for arranging this. I hope we are going to have a exciting conversation. Thank you.
I'm muted. I didn't notice that. Thank you very much, Dr. Riaz. That was very informative. We really appreciate it. I look forward to our conversation, to our discussion. But for now, we have two other esteemed speakers. And my next speaker is going to be Dr. Kizil. So just give me 1 second. Stay with us, Dr. Ali and Ms. Diana. Just going to remove from the stream shortly. All right. Well, my next esteemed guest speaker is Dr. Çağhan Kızıl. I apologize if I butchered your name. I tried to practice. Dr. Kizil is an associate professor of neuroscience in Helmholtz Association of German Research Centers in Germany. He obtained his BSc from Middle East Technical University in Ankara in Turkey, MSc from University of Göttingen, and PhD from Max Planck Institute, Tübingen in Germany. His research focuses on stem cells and their therapeutic use in Alzheimer's disease and neuroimmunology. As a scientist, Dr. Kizil became a vocal public figure, extensively talking, writing, and sharing about the COVID-19 coronavirus pandemic in Turkey. Besides his scientific publications, Dr. Kizil also writes about academic freedom, both in Turkey and abroad. He is also an active member of Research Institute on Turkey, a New York-based nonprofit organization. Dr. Kizil, welcome, and let's hear from you about the situation, the COVID situation in Turkey.
Dr. Musaseb, thank you very much for your invitation and a kind introduction. Well, actually, to summarize what the Turkey situation is, I think we need to underline what three pillars of the struggle against the COVID pandemic in the world is, in the most scientific way that we can envisage and actually designed. So there are three pillars. For the first, when we first encountered the virus, so we had to understand what we were facing and what was the whole situation is about. So clarifying the conditions and understanding how we can manage the whole situation. So it was a little bit more scientific, and now we all know that it's a virus. It transmits from human to human, mostly through different ways, and the transmission routes are well characterized. So the second was, of course, finding out the methods of isolation and the quarantine. So how in the countries we would need, what we would need to find those people before they spread the virus and isolate them and reduce the transmission. And the third, and very important as the other two, is the communication of the governments and the politics to the people, and the trust that they could give. So how efficiently they would communicate through the pandemic and build a trust so that the people will believe in what the governments do. Actually, these three are all written in many national pandemic plans even before this COVID-19 pandemic. But Turkey seems to be not doing this very well. Is there any country that wonderfully did all these three and prevented the income of the virus and transmission? No, but there were scientific ways that many countries tried to follow. Turkey was, I think, not one of them. So I'd like to give a little bit basis about the timeline of the pandemic in Turkey, so that it will clarify what I would actually mean. So we are now in Turkey experiencing what people call the third peak, but we are not sure exactly how many peaks that happened. So the first peak was in April 2020, and the second one was declared in December. Now the cases are rising. The first case was declared in March 11th, the same day the World Health Organization declared the whole epidemic as a pandemic. And the cases increased since then. The first restrictions were taken in March and April. They include lockdown for age-restricted populations. That was specifically 65 plus age people were under house lockdown, and also the schools were closed. But the population that were mostly carrying the virus, now it's scientifically proven, is more younger populations. The working class, which is between the age mostly of between 20 and 50, but these people were not touched. And it was one of the major concerns in the beginning, because the regulations or the restrictions that were not enough to prevent the spread of the virus. And actually that was the case. We also had technical hurdles, such as the test capacity was very low in the beginning. And the categorization of the patients were not done according to the World Health Organization's regulations. And in the beginning, that's why there were very low case numbers in Turkey, and there were very low official numbers and deaths in Turkey. And Turkey, the government and the ruling party was very proud of this in the beginning, and they always portrayed this as a success story. But we later turned out that this was not the case. There are several reasons for this. One, the number of tests made to the people were very low. The test positivity was very high. That's why if you have, of course, low tests and categorize only the people who are having a PCR test positive as COVID patients, then of course the numbers would be very less. And indeed, the Turkish Medical Association, a progressive medical association, throughout the pandemic, issued many reports every month, every 2 months. And the last report was 800 pages. So really underscored this. So the tests are not doing well, as numbers that are required, and deaths are not categorized as they are supposed to be. Because if you categorize only test positive people as COVID patients, the deaths that happen when the tests are turned to negative, because one patient, when you get COVID and you stay in the ICU for very long, your test will turn negative because the virus leaves your body, but the secondary effects will lead to death. This was very prominent in Turkey, but all these patients who died were listed as not COVID deaths. If you look, the data transparency was a big issue in Turkey, because all through this time, in the first and the second peak, we didn't know exactly the regional statistics, the epidemiological details, and the scientists in Turkey, if they were to do any research, they had to get permission from the health ministry, and that permission was not given to everyone. There was the Turkish Thoracic Society published an article in one of the major medical journals, Lancet, telling the whole scientific community that the science is interfere in Turkey during the pandemic, and the actual numbers, the portrait that we can get wasn't really easy to grasp. So actually, this turned out to be very true, because towards the end of the year 2020, the health minister one day declared that what the ministry gave as numbers, as official epidemiological results, were actually the people who were admitted to the hospitals, and they were showing severe symptoms. So basically, the case numbers in one day increased by 1.7 million. So the current cases are about 4 million in Turkey, but still the number of test positivity is 20% as of today. So Turkey, as of today, is one of the first 3 countries in the world who are having the highest number of cases, but also among the highest when you proportion this number to the population. We are following India in the case numbers. So this data transparency wasn't there. We didn't know how the pandemic was going on. The test numbers were not high. One of the reasons for this is, from the very beginning, the decisions that the ministry took in terms of production of the test, in terms of all other scientific endeavors, were behind the closed doors. And actually, there was only one company commissioned to produce the PCR tests in Turkey, and that company couldn't provide a lot of tests in the beginning, so we missed many cases that went undocumented. The mobility is an important issue, because if you cut down the mobility in the societies, you have a good chance of bringing down the transmission, although you can't prevent it totally. But what happened in Turkey in 2020 is that these mobility restrictions were not there at all. The tourists in summer could come without any tests. And the people in Turkey were encouraged to go on vacations, and they were given bank credits to do that, despite the fact that most scientists and Turkish Medical Association warned against this, because the pandemic was at its height, and this mobility would basically increase. There were also other issues, so more politically oriented decisions that were taken by this mobility issue. Many people within the country could travel, and coming back from their religious prayers from other countries, they were allowed to move freely. And the political organizations, so mostly the government's own organizations, in terms of party meetings with thousands of people in small confined spaces, helped in certain regions to increase the transmission of the virus. Plus, Hagia Sophia was converted into a mosque with big fuzz, and this also gathered more than 300,000 people at a very small location of Istanbul, and that is believed to increase the transmission. So the variants of the virus emerged around the world. We knew from different genomic sequence analysis, but Turkey was very late in finding out these variants. Now, as we know, the so-called the B117, the British variant, is so much in transmission in Turkey. And of course, there are other variants also undetected. So these also affected Turkey's ability to vaccinate and also use the vaccines efficiently, which is also another issue. From the very beginning, Turkey was very proud that they would get 40 million doses of vaccine in 2020 and the beginning of 2021. But currently, the numbers are not definitely not there. So 19 millions of doses of vaccine was administered to people, and 7 million people got 2 doses. which is 8% of the whole population, and 4 million people got one dose, which is 5%. We are far from getting to herd immunity by immunization. And basically, if you don't have immunization, you have to impose a certain controlled democratic lockdown in order to reduce the transmission, which in Turkey is basically totally the opposite. Another thing, June 1st, 2020, although the cases were rising and all the epidemiological indicators were upwards, and the scientists and the doctors said, no, we should keep lockdowns and we should even make them harsher. June 1st was the day of normalization without any restrictions. So the whole society was given the freedom to move, which also increased the transmission. So when we came to fall in November and December, the cases increased, the deaths increased, the ICU capacity was really pushing. And given that the vaccination and the vaccine rollout is delayed, so this generated a seed of transmission that now we cannot control. In Turkey, the current situation is really dire because we are not vaccinating well, but at the same time, the community transmission is so high off the chart. And even the Science Council, the ministry generated a Science Council, and that council was really ineffective. They couldn't openly speak, but they started to talk that the normalization or the opening was a mistake, and no one listened to what we said. So the Turkey basically, I can say that the characteristics of the Turkish pandemic management is one wasn't according to the scientific criteria. So what science said around the world, or the scientific council said, or Turkish Medical Association said in Turkey, it wasn't implemented. There was a lot of resistance, and the major drive that was also spoken out, spelled out by officials from the government is the economy. So we couldn't afford a lockdown because the economy should move on. However, during this time, there were a few corruption cases, and there was lots of money missing, and that money could be used for sustaining the lockdown and giving people the means to stay at home for a while, so that we could curb this community transmission and prevent the surge of the virus. But this wasn't the case. The Turkish Medical Association was targeted by the government and its allies, and they said these are terrorists and they are trying to lock down the country and prevent the progress. And basically, this was the case. The Science Council was ineffective, I said. The vaccination is not there. So there was a double standard. There was no data transparency so that we could project to the future what would happen in Turkey and get regional precautions to that. And the economic benefit was more at the forefront rather than the well-being and the health of the whole community. And still we are in a dire situation, but it seems like there's no plan. The minister this week told that many of the people, the risk groups who are to be vaccinated, approximately one fourth of them, didn't go to vaccination. The anti-vaxxer positioning in the society is increasing because when the government chose to get only one vaccine from China, the Sinovac, the minister told, well, we don't believe that the mRNA vaccines are safe. That's why we don't want to have these for our people. So now we know that the mRNA vaccines are one of the safest vaccines and the most effective ones. And so these sort of rhetoric deterred people from trusting the vaccines, trusting the science. The anti-science positioning is also covertly imposed by the government and the minister. As I say, I think there's the only way is to reach to the herd immunity. But from the very beginning, I had the impression that the herd immunity is not aimed with vaccination, rather by people getting sick, and then natural immunization was thought to be the way, because the economy should not have stopped, and you don't have a vaccine and you don't have the means to impose a lockdown. So that was the only way I think the government took and decided. So Turkey is not in a good situation right now. We are not sure what will happen in future and how long this peak will keep rising. Now the incidence in Istanbul is so high. We are having 60,000+ cases every day out of 300,000 tests, and the test positivity is 20%. In such cases, you had to increase it to maybe 2-3-fold. And if you increase it, in Turkey, there will be more cases. So the community transmission is out of control, and I don't think that the ministry has a plan. The only plan now is to keep the economy going, and trying to, as I have to say it, and this is really backed up by numbers, to hide the actual numbers and to try to show a kind of a success story. One of the ministers published a book last week saying how Turkey handled the pandemic very successfully, a success story. I don't think there's a success story in the whole table that we see every day, and actually the society cannot intervene in what is being done. Actually, we don't know how the situation will unfold in the coming weeks, which seems from the field, the news we get are not really great news. Maybe I think I'm over time, so I should stop here. And if there are any questions specifically, then I can answer for Turkey.
Thank you so much, Dr. Kızıl. We really appreciate this amazing, sharing of information. Very informative. I'm going to take my last speaker now. Give me a second, and then we will convene all of us to have. Kind of like a roundtable discussion, if you may call it. All right, so it's my great pleasure, really, to introduce one of my friends and one of the women I look up to, Ms. Diana Buttu. Ms. Buttu is a Palestinian-Canadian lawyer and human rights activist. From 2000 to 2005, she served as a legal advisor to the Palestinian negotiating team and later to the Palestinian President Mahmoud Abbas. She's a frequent commentator on Middle East politics and human rights, with op-eds and appearances in major international media outlets such as the New York Times, CNN, BBC, Al Jazeera, and Wall Street Journal, and the Washington Post, among others. She holds a BA and LLM from the University of Toronto, a JSM from Stanford University. I'm not sure I know what that is, but I'm going to read it. A JD from Queen's University and an MBA from Kellogg Northwestern School of Business. Ms. Buttu is the recipient of numerous human rights awards, including the Italian Stelle Solidariete Prize. Welcome to our chat, to our panel, Ms. Diana Buttu. It's all yours now.
Thank you very much, Dr. Ahlam. It's really an honor to be with you, and I'm actually very much a fan of yours. So it's really good to be able to be with you today on this panel. I also want to thank my co-panelists. I've learned a lot just in this short time about the situation in Bangladesh and the situation in Turkey, and of course it goes without saying that I really want to thank the Center for the Study of Muslim and Arab Worlds for hosting this. This is, I think, a very important discussion, particularly at this particular time. For me, my talk is going to be a little bit different than the other two that we've heard so far, because we're facing very different circumstances here in Palestine. To be clear, and I want to begin by saying that it's important to look at the overall political context within which Palestine is operating. Palestine is not an independent nation. It's a place that has been under military occupation for more than 5 decades. And as a result of this military occupation that has taken place for more than 5 decades, we actually have grown to see a system of apartheid. And what I mean by apartheid is this is an apartheid system that has been described not only by me, but by others, including Israeli human rights groups, in which we see that there is one overall regime that is in place, which is the Israeli government. And based on that one overall regime, we see different sets of rights, different levels of rights that are afforded to these different populations based exclusively on religion. And this apartheid regime, which is political in nature, has also transcended into being medical apartheid as well. And I want to be clear in saying that this medical apartheid predated COVID. It predated COVID because what it means to live under military rule is to effectively not have control over your life. So simple things that a hospital would normally need to be able to import into their country not only require the ability to bring them into the country, but also require Israeli permission to be able to do so. So, for example, radiation equipment, which is used to radiate certain types of cancer, in particular breast cancer. There isn't a single Palestinian hospital, whether in the West Bank or in the Gaza Strip, that actually has this radiation equipment, because Israel won't allow this medical equipment in because it violates, quote unquote, Israel's security. And so as a result, we see that individuals who need to get treatment are required to either go into an Israeli hospital, get permission to go into an Israeli hospital, which isn't always granted, or go abroad, whether to Egypt, otherwise in the case of the Gaza Strip, or to Jordan or otherwise in the case of individuals who are living in the West Bank. Now, this what COVID has done is, as many of as the other two co-panelists have indicated, is that it's exacerbated the underlying situations that we've seen in these countries. And in the case of Palestine, we've seen that COVID has actually exacerbated this medical apartheid system. And I want to give you some numbers so that you can see and understand where it is that the system is working or effectively not working when it comes to Palestinians. So in terms of population, there are roughly just a little bit over 9 million Israelis. And in terms of population on the Palestinian side, there's roughly 5 million Palestinians. And so looking at this one population, now remember, this is all controlled by Israel. Yes, there is something called the Palestinian Authority, but at the end of the day, they need to obtain Israeli permission to be able to do things like import ventilator, to be able to bring in ventilators, to be able to bring in the vaccine, and so on. So of this population, as it stands right now, there are only, in Israel, there are only 2,984 active cases of COVID, with a daily rate, yesterday's daily rate was 256 infections. Contrast that with what's happening in the West Bank and in the Gaza Strip, where we have 32,000 active cases, including 21,000 active cases in the Gaza Strip alone, with the Gaza Strip's population being 2 million people. When it comes to the daily infections, we see that in contrast to the 256 that were infected, the numbers that came out yesterday inside Israel, that in the West Bank and the Gaza Strip, there were 1,700 daily infections yesterday alone, including 1,200 in the Gaza Strip alone. Now, why the disparity? The disparity is lying very much in the fact of the level of healthcare, and in particular, the level of access to the vaccine that has been provided to these different populations. I don't know if many of you are aware, but Israel launched a very aggressive vaccination campaign back at the tail end of 2020 with the aim of pushing forward this campaign as quickly as possible. In large part, this vaccination campaign was done to coincide with the Israeli election, which just happened a little bit more than 2 weeks ago, almost 3 weeks ago, to make sure that people would be able to vote in for the current Prime Minister Netanyahu, and reward him for being able to provide so many vaccines. As a result, we now see that of the Israeli population, that roughly 60% of the population have received the double dose of the Pfizer vaccine. And I want you to contrast that with what's happening in the West Bank and in the Gaza Strip, where less than 4% of the population have received one dose of the vaccine. And if you bring it down even further and look at a place like the Gaza Strip, whose healthcare system had already been devastated for many, many years as a result of a number of Israeli attacks on the Gaza Strip, we see that in that Gaza Strip where there are 2 million people, that roughly 27,000 only have received one dose. And so the contrast between the two has become very stark. And the contrast between the two, you see on the one side when it comes to the Israelis, that there's an economy that is opening. They have vaccine certificates. As of this coming Sunday, people no longer required to wear masks outside. Things like restaurants and gyms are reopening. And yet, if you look just a few kilometers away at the West Bank and what's happening in the West Bank and in the Gaza Strip, it's actually going in the opposite direction, with the number of infections going up on the rise, and the number of deaths also rising with it. Alongside with that, we see that the Palestinian economy is also plummeting. The reason that we see that this economy is plummeting is akin to, just like we have a system of political apartheid and medical apartheid, so too the Palestinian economy is very much tied into the Israeli economy. And as a result, with all of the infections that have been happening in the West Bank and in the Gaza Strip, that economy too has suffered, with the inability of the government to be able to actually provide any assistance or any support to those individuals who need it. So there hasn't been a stimulus check. We haven't been able to see that the government has stepped in and been able to help people. There is no social security network to be able to help those individuals who have been infected. And so when faced with the choice of to go out and work, even if you feel symptoms, versus not go out and work if you feel symptoms, sadly, the calculation ends up being to put food on the table for families rather than the other way around. The situation has become so stark and so stark between the two areas that you simply need to look at the issue of ventilator use. While on the Israeli side, we see that the healthcare system has largely recovered from the devastation of COVID. When it comes to the Palestinian side, all 200 of the ventilators that they currently own are currently in use, with doctors now needing to make decisions about who is placed on a ventilator and who is not placed on a ventilator. I'll let you answer the second part of that, effectively determining who's going to have to struggle and who will be able to get that level of support, that level of care. So all of this is to say that we see this stark difference, but not only do we see this stark difference, we've actually seen that on the Israeli side, that it isn't just a question of vaccinating their own public, but also making decisions not to vaccinate Palestinians as well. And I say this because Israeli health officials, many of them, have come forward and indicated that the only way that Israel is going to achieve herd immunity, which I heard a couple of you, both of you talking about, is for the entirety of the population, or the vast majority of the population, to actually be able to get vaccinated. And yet what we've seen that the Israelis have done is, instead of providing those vaccines to Palestinians, we've seen them do two things, both of which are showing the ill intent when it comes to the Israeli government, and showing just how political the issue of COVID has been. So one measure that they've done is that so far the Israelis now have so much of a surplus of vaccines that it's roughly estimated to be 7 times the population that they have. And instead of giving those additional vaccines to the Palestinian population, they've simply held on to that vaccine. Even during the height of the vaccination campaign, where there were surpluses that were remaining, and once again, instead of giving that surplus to the Palestinian Authority, and for the Palestinian Authority to be able to vaccinate people who are living in the West Bank and the Gaza Strip, we received reports of roughly 7,000 doses being thrown out each and every day. Now, to make matters even worse, it's not just a question of hoarding the vaccine or holding on to as many doses of the vaccine, but Israel has been using the vaccine to also get political leverage. For example, 2 countries that illegally recognized Jerusalem as Israel's capital, being Guatemala and Honduras, ended up in exchange, the quid pro quo, receiving several thousand doses of the vaccine. So we see that not only has the vaccination campaign, the Israeli vaccination campaign, being used to exclude Palestinians, but it's actually even being used to harm Palestinians. And this is why there has been such a great level of attention that human rights activists have been paying here to this vaccination campaign, to make sure that the world understands that it's Israel's responsibility as the occupier, as the person that is in charge of this overall apartheid regime, to make sure that Palestinians receive adequate health care and that they are entitled to be able to get the vaccine just in the same way that Israeli citizens are getting the vaccine. And so we're now entering into a very interesting phase of vaccine or COVID litigation, let's say, where there is a lot of attention that is being paid by lawyers and by human rights activists to try to push the Israeli government either to, the first phase of it was to open testing centers in parts of East Jerusalem, to then provide vaccines to individuals, Palestinians who are living in East Jerusalem, who, although they are Palestinians, are also, and not Israeli citizens, they're permanent residents, to now being able to push for vaccines to be able to safely be transported into the Gaza Strip and into the West Bank. I want to end my talk by just giving you a flavor of how this system works in practice, so that it doesn't remain so abstract to people. Just the other day, I was in a small town that is called Barta'a. Barta'a is one of 3 Palestinian towns that was divided in 1948. Divided meaning that the green line actually runs through it. And so one portion of the population lives in what is current day Israel, another portion of the population lives in the West Bank. But it isn't so seamless, it isn't so neatly drawn. In many cases, we see that families have been split, where you have one brother living on one side, and another brother living on the other side, and so on. But of course, love doesn't prevent people. Love doesn't really look at borders. It doesn't look at whether there's a green line or not a green line. And Barta is one of these towns where you see a lot of couples where one spouse is from the West Bank and one spouse is from Israel. And I visited a family that exactly fell into this category, where the wife is a person who holds Israeli citizenship and ended up getting vaccinated, and her husband, who doesn't hold Israeli citizenship, who's considered a West Bank resident, did not get the vaccine. And from that, we also see that just within this one family that some in-laws have it, some in-laws don't have it. Again, all to say that this is a small place, it's a small country, and the vaccine doesn't discriminate as we all know, doesn't discriminate on the basis of whether you're Christian, whether you're Muslim, whether you're Jewish. And yet we've seen that one of the major challenges has been that when it comes to politics, that the politics are getting in the way, and it's the politics that are discriminating between who's Christian, who's Muslim, and who's Jewish, and accordingly who gets the vaccine and who doesn't get the vaccine. So thank you very much for inviting me, and thank you also to my fellow co-panelists.
Thank you very much, Ms. Diana Buttu, bringing all the panelists now so we can have a conversation. So what we are going to do now, we have a few questions in the chat, both Facebook and YouTube. So I'm going to ask those questions. But before, I have a question for all of you, because we talked about the current situation and what happened during the last year or over the last year. And my question is about what people now are always wondering, and the discourse around COVID now is, when are we going to go back to normal? So my question for each one of you is, one, is there something called normal? Can we ontologically, for example, assume that there was a reality before COVID that was actually normal? And what is normal? Also, if there's such a thing, if such a thing exists, what are your projections for the future? Are we going to ever have post-COVID normalcy, or is COVID going to be actually impacting our lives forever, as some people projected or predicted? So if you could think about that, might be a little bit of a philosophical question, but based on the reality in each country, what does each one of you think of the future? Is it going to be post-COVID or not, or how is it going to look like? So who would like to start? Go ahead, Diana, please.
I can try to answer this. Yes, I think there is a post-COVID, but I don't think the post-COVID looks the same as pre-COVID, which is to say that, as I mentioned, here in 48, things have begun to open up. We are seeing that things are, I don't want to say to normal, but they've definitely changed over the course of the past year. That being said, I'm actually very worried about all of this, because there's been such a thirst to somehow be done with all of this and to just ignore 2020 as though 2020 didn't happen. And if anything, I think that what we should be taking from this year is not just the physical restrictions and so on and so forth, but the idea of what it means to have health as a human right, what it means, and what it means that when we speak about human rights in general, that we see as Dr. Riaz, I think, was saying, that we're in a world of the haves versus the have-nots, and so I really would, from where I live right now, I can tell you that things have changed. It's opened up, and people are almost back to quote unquote normal, but it's that normalcy that for me is frightening, because I think that we should have learned some major lessons from this, particularly when it comes to issues of health and human rights.
May I jump in?
Yes, please. Dr. Riaz, I was about to say, could you please go ahead?
No, that's fine. I mean, to start with, at the beginning of this pandemic, there were hopes and concerns. If we recall, it has been more than a year, that there will be something that we are going to learn out of this. Unfortunately, we haven't. As a matter of fact, when someone tells that we're going back to normal, I become worried, because it is the normal that brought us in here, right? I mean, before, let's say 2019, December 2019, when we didn't know, Chinese officials knew, but we didn't know that the pandemic is coming or something like that. The entire structure and the economic policies that have been pursued, that is what brought us here. If we look at the United States, the death of 500,000 people, more than 500,000 people, unnecessary death because the public health system, the normal public health system, which we thought is good or we told good, couldn't take care of it. So if we are going back to normal, are we going back to the same that practically in another pandemic, or God knows what else, hopefully not, we're going to lose another 500,000 people? Do we accept that as a norm? So all these expectations that, yes, this would bring up some changes. In terms of global order, it hasn't. It's the same, because the power and resources are restricted, and we are seeing with respect to the vaccine thing, that when we are talking about vaccine, the disparity that we see is not something different from the normal. Hence, each time we are talking about normal, it makes me a little bit worried that should we actually go back to normal? Meaning, yes, we understand, and I understand that we're talking about at least the normal life. I can see the friends. You can go to your family. You don't have to visit the hospital. You don't have to worry that what is next, whether there will be another morning for us or our friends, family. But at the same time, the question needs to be raised that have we learned anything? The post-COVID scenario, what is the projection? Will there be a post-COVID? Two things, and here I'm speculating to a great extent. Two things that comes to my mind. One thing is that we are going to live with COVID. It would be like flu. That's my understanding. I'm not a public health expert. I'm not in the medical science, but it appears to me that
we have Dr. Kizil, who might have some.
No, I mean, like flu would be like this. It would, whether it is limited to a great extent, as we live with flu, every flu season, people unfortunately dies. We go to take the vaccine. Some of us don't, some do. Some are those people who think that vaccination is a conspiracy. God knows what sort of conspiracy they find. But there will be. This would be the. But if we are talking about post-COVID in terms of any structural changes, whether at the global level or at the national level, whether in the United States or in Bangladesh or elsewhere, I can speak of these two countries, lived and live in this country. The likelihood of a post-COVID situation is not there. It is going to be a continuation of the apartheid that Diana was talking about. That apartheid is going to continue, unfortunately. We have not learned that the COVID has laid bare the economic disparities that this country, for example, that people had to line up for food. And at a time where spending billions of dollars. I should speak in trillions of dollars in a war effort, in defense expenditure, and God knows what else are we spending, Yet in this country, this is the situation. So, all these things, I know these are very fragmented thought, but these are the ones that I think we need to take into account, that this is not going to be a drastic different world. This is not going to be different. I wish there was. Except, yes, the China is rising, yes. Are we be more in surveillance? Yes, because the health, there are these and that. In some countries, they have taken it too far. But other than that, what is going to happen? Is there going to be a dramatic, drastic change? I wish, but I don't. I wish, I hope, but it's not going to happen. I don't see any indication of it.
All right, thank you. Dr. Kizil, would you like to comment? And before I give you the mic, I just want to explain that we were supposed to have an expert from Southern California, an epidemiologist, Dr. Bahjari, who's originally from Yemen, to talk actually about Yemen, which is under severe war also, and they are facing terrible humanitarian catastrophe actually as we speak, in terms of hunger, in terms of COVID, in terms of everything basically. But unfortunately he couldn't join us. So Dr. Kizil, it's all yours now.
Thank you. Well, those two questions you posed are actually interesting questions. Will there be a normalcy? Yes, we will have a normal life, but what that normal mean is definitely, as my fellow panelist mentioned, we don't know. I can talk from two perspectives, like a personal perspective. I'm not a political scientist and I'm not a sociologist, but definitely the pandemic gave some permission or eased up some governments' methods to legitimize the anti-democratic use of this whole system. Surveillance is one thing, but on top of that, changing the norms on the management of the public system, so that they will have a larger control, and the checks and balances in the societies to control are abrogated. So that's one negative part. There are dark sides, there are bright sides. Maybe we can also find them. And second, I think what I have seen is that the normal that we had before the pandemic is actually manifesting itself. The whole situation of the pandemic, if you look at the epidemiological or demographical analysis, so this pandemic is like all other issues of the society, is a class-related thing. So if you look in the US, if you look anywhere, so the people who died more, the people who got contracted the virus more, are the people who didn't have the luxury to be able to stay at home and not go to the work. So, and those are the people that, especially in Turkey, but most other places, were still forced to go to the work. And they had to choose between losing their jobs if they don't go to work and not feeding their families, or contracting COVID and maybe dying. So actually nothing changed. Before it was like that, now it's like this. So maybe what changed in the whole world with the COVID is like the people who are privileged had more chance to be restricted, as they didn't want. And this is exactly why the whole world is a little bit more cautious about that. Otherwise, I don't think that normalcy changed. But from a scientific perspective, I want to bring one aspect. So why pandemics happen? And are there going to be other pandemics in the world? So as the science says, yes, there will be more pandemics, because maybe not COVID-19 will end, maybe it will turn into a manageable seasonal disease where we will have vaccines, we will have drugs, but there will be other microorganisms, there will be other pathogens that will spread. This is a natural course that we intervened as humanity. We deforested the whole world. We increased the consumption in a more skewed way. Now the wildlife in the world is only 4% of the whole animals in the world is only 4% wildlife. The other 90+% is for human consumption. For this consumption, we change the forests, we change the land in order to feed those animals, and also that also brings the transformation. So pathology, the microorganisms or the pathological agents that we would normally not see or touch, or that they cannot transmit into the humans or intermediary hosts, now have the chance to do that. This changed the whole world, and that's why we are having increased pandemics. This is not the only reason, definitely not, but this is a major reason. So what will be the normal? I think the normal will be that maybe the countries will be a little bit more prepared for such a drastic, immediate transmission of a virus or microorganism that leads into pandemic. But I see this less likely. We generally, as a humanity, not learn the good things, but we always learn the bad things, and then continue with that. The one positive aspect that I see in the whole world is that people started to listen to scientists a little bit more, rather than the politicians. And it was, but it will fade away very quickly when the whole pandemic goes away, and we will all get back to all these conspiracy theories and everything. That will be a normalcy. I agree. We will have a normal life, but that normal will never be the same as the previous one. Worse or better, we'll see. But I'm generally not so optimistic about these sort of things.
Well, thank you so much. I don't know about listening to scientists, because I also like, my specialty is digital media. So I look also at a lot of misinformation being spread on social media, which are very antithesis to scientific, conclusions. So I'm happy or a little bit hopeful about that. Let's hope that it would actually continue to happen. Well, I have another question for everyone, but I'm going to put it aside because I have several questions. And I'm going to go with the first one from one of my students, actually, Leo. He's asking questions that probably some of you already addressed, so I'll leave it up to anyone who would like to take it on. He asks, does the Middle East have a COVID relief system like in the US? I think he meant each country, and I know Diana already responded to that, but anyone would like to maybe talk about the specific case of their corresponding country? If not, we'll take the other question.
Well, I can very briefly say a few words. Turkey doesn't have a stimulus package. It never had. So the government says they had, but in the beginning of the pandemic, they opened a bank account and asked everyone to contribute to that in order to fight the pandemic. So normally it should work the opposite, but Turkey did the other way around. And as I mentioned, I don't see a real relief system. Well, let's face it, no country could really provide the relief funds that was necessary, but only part of it, and Turkey wasn't definitely one of them.
I'm just sharing some of the comments from some of the speakers. The first one was from Dr. Yazamin Deldar from our university, and the second one by Dr. Wendy Smith, reflecting their own reflections on the question. Thank you so much for actually participating. Let me go to a question by Dr. David Yagobian. I'm going to put here. How has US sanctions exacerbated the COVID crisis in Middle East, like Iran, Syria, Lebanon? He then sent me a text and said he should have said West Asia, I think. So, yes. So, would anyone please, do you have any response? This is open.
I can speak to Charleston, if that's okay. Okay, so and I'll try to tie it into the previous question as well. So the Palestinian Authority's budget it's not a natural budget because like they don't have it's like not a natural economy because the system is under military occupation, which means that if you want to import something, you need Israeli permission. If you want to export something, you need Israeli permission, and so on. And so as a result, the economy itself is also under military occupation. And being under military occupation, it has meant that the budget of the Palestinian Authority has often been dependent upon donor governments. So 60% of the budget of the Palestinian Authority being the largest employer, that's why I'm focused on them, 60% of the budget of the Palestinian Authority comes from tax revenues that ironically Israel collects. So Israel collects the tax revenues and then is supposed to transfer it over to the Palestinian Authority. But for many political reasons, they choose to hold on to it without any pressure that being brought to bear on them by the international donor community. The remaining 40% of the budget of the Palestinian Authority comes from individual donor countries. And so what this has meant during the period of COVID is that as countries are turning inward and looking at providing stimulus packages for their own citizens, that level of donors, of donations or donor support to the Palestinian Authority actually dropped significantly. And at the same time, the Israeli government still continued to hold on to those tax revenues. And so what that meant was that that there was no way that they could have provided any type of stimulus package or relief. And as I mentioned in my talk, there is no social security system here that's in place when you retire or otherwise. So people were faced with the choice of, if you have to work or not work, you're going to go out and work. So this luxury of being able to stay at home or to shelter in place, it wasn't happening. I didn't mention all the other things about the politics of it, but that I wanted you to know about. And so one of the issues, what happens when it came to the United States, was that under the Trump administration also decided to cut funds to the Palestinian Authority. It did so at the same time that first it moved the embassy from Tel Aviv to Jerusalem, and then it slowly started to cut funds to the Palestinian Authority, including much needed funds that were going to Palestinian hospitals. So it wasn't that they were actually imposing sanctions on it, but that much needed financial support was no longer coming in. In addition, the United States also cut funds to UNRWA, which is the United Nations Relief and Work agency that deals with Palestinian refugees. So Palestinians were doubly hit. First, because their economy was not able to flow. It hasn't been able to flow for decades because of military occupation. Plus, the Israelis had held back money. Plus, the donors were no longer contributing. Plus, we had this system in which the United States had also stopped giving money to the Palestinian Authority and to UNRWA. That has since changed. We've seen that they've since resumed money to UNRWA, and there's talk of them resuming, but they have resumed support to Palestinian hospitals, but the damage has definitely been done there.
Thank you so much. And the other speaker that we couldn't have today, probably he's in surgery now, is Dr. Firass Abiad from Lebanon, who was supposed to talk about both the terrible, mainly economic crisis in Lebanon after the huge explosion that happened in summer, and its terrible impact on not only Lebanese but also Palestinian refugees and the refugee camps in Lebanon. But unfortunately, we didn't have that chance. Maybe in the future we'll host him again. I have a question from Dr. Hold on, let me put it here. So can COVID be an excuse for much worse new normal in terms of labor control regime with remote work and an attack on public education in addition to legitimizing anti-democratic systems?
If I may, this is a very important question, and this is a larger implication going forward. globally and the United States, globally more so. This, what we have seen with this neoliberal economic policies over the years is informalization of economy, labor, basically, because the informal sector has immersed and the unionized situation, the unions have been broken, and there's been no effort, or at least any effort that has been taken has been frustrated, because now we are considered as you are on your own. I mean, you work, you get the money, and that's it, as if that is all there is to it. You know, this started with the new International Division of Labor, and then it proceeded with these neoliberal economic policies that, thanks to our very beloved Mr. Reagan and Margaret Thatcher, you know, he's now considered as an icon. And I don't know how is that, but nevertheless, the point is that now with this work from home kind of thing, that would actually limit the interaction and limit the rights of the workers. Uh, I mean, you may say that not everyone is going to work from home. Of course, there will be people who would have to work. If someone is driving a truck, he or she cannot do it from home. They will have to do it. But having this kind of arrangements that encourages the disassociated mode of work is going to create a more control of the management on who is working, what he, she is working. That is a very, very much, a potential. I am personally opposed to this work because I think that is a part of this thing called, that is going to devastate the social cohesion thing, socially speaking. The workplace is a social cohesion, and bowling alone kind of thing might actually increase. But more importantly, on its impact on labor. The second thing is, again, with respect to the public education. And here in this country, in the United States, public education has become disdained by the conservatives. What they have done, and thanks to Trump administration and particularly the Secretary of Education, what she has done. You know. Now, with this kind of situation, if it continues, if it encourages the homeschooling kind of thing, should there be a choice? Yes, there should be a choice. But public education should not be curbed, restricted. This is our commitment. The state should have that commitment. And if we are taking this opportunity to reduce the funding, already it is poorly funded. This is going to have a deleterious effect going forward. Already our education system, U.S. education system, has fallen behind compared to Europe and many Asian countries. This would be an opportunity to. Final point is this what Professor Kızıl had brought in already. The anti-democratic thing. Already we were in a global backsliding for the last 15, 16 years. And now since 2020, if you look at Poland, if you look at elsewhere, even in Britain, what we have seen, all these emergency restrictions, we have entered into a perpetual emergency. I call it a perpetual emergency. That everything in the name of public health, despite the fact that it's not saving us, all these restrictive measures have been, surveillance has been expanded. And all these things is going to continue because once you do it, it's very difficult to step back. In this country, in post 9/11, the Patriot Act, the so-called Patriot Act, the things that we lost in terms of our privacy, how much have we regained 20 years now? No, a little bit of it, but not all of them. We have never been in pre-9/11 situation, pre-Patriot Act situation. And it is happening elsewhere. It is not only in the United States. It's happening in many countries, particularly where there are fragile democracy. Already they were in the backsliding mode. Now it has been ever devastating, and all these things are legitimized in the name of public health. Everything is legal. They're doing it. If you look at them, have you done it lawfully? Of course. First create the law and then do it lawfully. It is like, yes, I'm going to write a law that say that I'm going to kill you, and then say, see, I did a lawful thing, I killed you, kind of situation. Those are the more important elements that I see going forward.
All right, thank you so much. We have a question from a student, but first I apologize to Leo and Santiago. It was Santiago who asked the question, not Leo. Apologies for that. But now another grad student, actually, Nicholas, he says, in your opinion, what steps can we as a global community take so that we better be prepared, I guess, for the next pandemic? One would like to...
In a sense, public health question, but from a political point of view, and I will be very blunt, having a better public healthcare system, number one, this entire system that we have witnessed, which is the disparity is high. I mean, why Black and Hispanic and Asian community has disproportionately been suffering? Because the healthcare system itself, already there are many places that are geographically segregated. New York is a case in point. I live close to Chicago, and as you can understand, this segregated thing. But the healthcare system itself has an enormous disparity that is built. So what can we do? If we really want to do it, do we have the political will to do it? Then the public healthcare system needs to be there. And there is no other way. Possibly United States, if I'm not wrong, is the only industrialized nation which doesn't have a national healthcare system. This is a shame for us. This is a shame. And going forward, the second element is that creating a system wherein the debate that we saw, whether it should be 1400 or 600 or the political football, pretty much the soccer game that we have seen pre-election and post-election, and particularly the Republican Party's objections. These people have paid for it. They are not, when they're asking, when they're in that situation, sending them 1400 is not coming out of anyone's pocket. This is, I have paid for. I mean, Mr. Trump didn't pay for that access, but I did. Frankly, I did. I mean, I can show you those pieces. So if I have paid for years, and if it helps my neighbor who is in a dire situation, why there should be a soccer game played in Washington for the political reason? So create that system wherein the emergency situation, if you have how that would be addressed. So these are the two elements that I see. But none of them are, of course, I'm not talking the public health sense. Someone would be better in terms of those elements. The political part that I can speak of.
All right. Ms. Buttu, did you want to say something, or anyone else would like to? Go ahead.
Yeah, I can't concur more. I think it's really important that we start focusing on health as a human right, and the importance of having health as a human right, rather than as a human luxury, because that's what I feel that it's turned into. And then I think there's other things that that also need to be looked at, and this again ties into the previous question, which is that one thing that here, living over here in this country, that I've seen is the rise of surveillance, and we've seen the incredible rise in surveillance as a means that's attempted to be justified because of the pandemic. So just everything that I can just show you from contact tracing, but then not just contact tracing, also the Israeli the Mossad, the Shabak was actually very heavily involved in monitoring people and monitoring what movement and so on and so forth. So I think that going forward, we need to start looking both at the issue of public health and the importance of public health, but also on the issue of individual freedom, individual security, and individual privacy as well.
Can I interject and say Shabak and Mossad, those are the two Israeli intelligence, because people are the two main Israeli intelligence bodies, you know. One is for internal intelligence and one is for international intelligence spying, in other words. Sorry about interruption. Okay, anyone else? Let's take the last question, I guess, from AJ Algon. I'm gonna put it here. Are there any new political alliances developing in the region as countries are fighting against the pandemic, both on medical and economic fronts, or are they relying on the same old allies? And this is also open, I guess, for anyone to take it.
Maybe I can say a few things. What I have been seeing, so for the previous question, I totally agree with the other two speakers that the public health system is important and we should see people not as customers, but as people. So a public health point of view is important to protect the whole society. And I think I had two other answers to that, but that leads into the second question. So I think the political alliances, I don't think for Turkey it changed. Rather, the political maneuvers was used, for instance, for the vaccines. It was most political decisions, and the allies were brought together. So also in the world, the vaccine was used kind of a political agenda within a political agenda. And the regions, if you look at the vaccines which are widely distributed from individual countries, you could see those alliances more or less. They overlap with the political agenda. I don't think, unfortunately, the people, and it's very rare that people, large communities within a country are on the same page for a certain aspect, which is ending the pandemic or following the science or getting vaccinated. But they don't have the means to affect the governments, and there are no mechanisms that they could influence and change. And those sort of the societal alliances, non-governmental organizations are acting the same way in Turkey. So there was no, unfortunately, they couldn't grow, they couldn't get more international overseas alliances in that sense. This is my opinion from a scientific perspective. I'm not a political scientist. I have to underscore that.
Thank you. Would anyone else would like to? I mean, Ms. Buttu, you actually mentioned a little bit of this about Israel actually, you know, trading recognition of Jerusalem as the capital of Israel with some countries who are in dire need for the vaccine. If you want to comment, or if someone else would like to add anything.
Yeah, I'd be happy to comment on this. There was the political alliances that created under this have been mostly in the realm of security, which is to say, because the Israelis they've been so effective for such a long period of time, effective, and I'm saying this in a negative sense, at monitoring Palestinians. We've been surveilled for a long period of time. This has been one of the things that they've been exporting, and they've been exporting the technology of it, but also the ideology of it. That somehow, because of COVID, that countries should be spending a lot of money and a lot of capital on surveilling their own populations. So that's one type of alliance that's been. But then the other one is the one that I mentioned, which is the trading off of the vaccine for political gain. So that some countries were actually coming forward, and in the past, if you look at when the Trump administration recognized Jerusalem as Israel's capital. This was several years ago. And yet we did, and there wasn't this wave of people who were then rushing to recognize Jerusalem as Israel's capital because it's illegal. And yet it was only under the guise of COVID that we saw that this was actually something that ended up happening, that we saw that that now countries have been pushing forward because they knew what the quid pro quo was, which was that if you recognize Jerusalem as Israel's capital, you could get the vaccine. Now, to be clear, that program has since stopped because there's been some litigation on it. They've been taken to court over the whole issue. But left to their own devices, they certainly will be going that way. I think I would have loved to see that there would be a greater in the region model of cooperation. But it's just not something that I personally have witnessed. Instead, what I've witnessed is the closing off borders and then kind of turning inwards, and not really this level of global cooperation and regional cooperation that I would have much preferred to see within the countries.
Thank you very much. I guess these are all the questions. I'm trying to make sure I didn't miss anything, but I think that's it. Yeah. So I would like to thank you very much, especially those of you who are on the other side of the world with a time difference of at least 10 or 11 hours between us. So it's way beyond your bedtime probably now. I really appreciate that these were amazing, important conversations. Thank you for sharing with us your information and your wisdom. We really appreciate it. If you have to say anything, any final thoughts, please feel free to do so. But thank you. We are ending this. All right. Have a great night for those of you on the other side of the world. And thank you again. And thank you, Dr. Riaz. I think you are joining us from the States, right?
Yes, I'm close to Chicago. I'm in
So
a place called Normal. In a very, my town is called Normal in a very abnormal time.
Oh, yeah. All right. Well, thank you so much, and have a great night
pleasure
for our other guest speakers. All right. I'm going to end the broadcast now.